If you've been dealing with ligament damage in your spine, you know how it can affect everything. Every movement, posture, even just getting through the day. And if you've been searching for answers, this episode is for you, because I'm about to break down the 5 things you must do in 2025 if you want to heal from spinal ligament damage and finally take control of your recovery. Welcome to the Posture Podcast. I'm Dr. Spence, a chiropractic physician with over 22 years of clinical experience focusing on injuries to the spine and trauma and degenerative disorders. I get it. There's a lot of confusion about what works and what doesn't when it comes to healing. But here's the good news. If you focus on the right steps, you can make huge progress this year. And that's exactly what we're going to talk about today. The practical steps that you can implement right now to start healing and feeling better. So let's dive in. These are the 5 things that can change your recovery in 2025. Let's start with the stability training, but this time we're going to focus on the cervical spine or your neck. And when it comes to ligament damage and instability, many people overlook the importance of strengthening the muscles that support the neck. These muscles are deeply connected to your spine, and they are essential for providing stability and preventing further injury. And when you have ligament damage or instability, these deep muscles that support your neck are weakened. And unfortunately, this leads to poor posture and more pain and a greater risk of re-injury. So what do you do about it? Well, you need to focus on strengthening the muscles in a way that provides real support and relieves strain from the damaged ligaments, instead of doing the generic exercises that might not be right for the spinal instability. You want to focus on exercises that are medically specific and target the deep muscles that stabilize your cervical spine. And that's where the Posture Academy's PostureFoundation program comes in. This program is designed specifically for helping people to deal with the ligament damage and spinal instability. The PostureFoundation program includes research-backed, clinically proven exercises that are tailored to stabilize your cervical spine and reduce the strain on the ligaments. These exercises are designed to target the deep muscles in your neck, and they also target the upper muscles within your back that are responsible for holding your spine in its proper alignment. And the best part, this program is entirely free, and you can join by clicking the link in the video description below. Now, by joining, you get access to exercises that have been tested and shown to be effective in helping people just like you strengthen their necks safely and, of course, naturally without any risk of further damage. This isn't about generic exercises that you find online. This is about medically specific exercises that have been research tested to help people with spinal instability. These exercises support your ligaments and they build long-term spinal stability, all while reducing the risk of pain flare-ups and, of course, further injury. So if you are ready to stabilize your cervical spine and improve your posture, just check out the Posture Foundation's program. It's completely free, and the link in the description below will get you started. Start strengthening your cervical spine with the exercises that are designed for your specific needs and begin healing today. Now, the second step is something that people often overlook, and that is regular professional care. If you're dealing with ligament damage, it's crucial to get the right care from someone who understands the complexity of spinal instability. Now, I know some of you might be thinking, well, I've tried a chiropractor before and it didn't help. But here's the thing, not all treatments are created equal. And just like stability exercises, you need to find the right kind of professional help. Chiropractors, physical therapists, and even specialized care like a Class 4 medical laser are all fantastic options for managing the ligament damage and helping with the pain that's associated with it. Hey, I just wanted to jump in really quick and ask you this question. Are you tired of living in pain and struggling to find answers to why your body feels like it's falling apart? Let me tell you about a book I wrote called Finding Calm, a journey through spinal ligament instability and the path to healing. It's the ultimate guide to regaining control over your health and reclaiming your quality of life. This book is designed to help you uncover the root cause of your discomfort, spinal ligament instability. It's not just about quick fixes, it's about understanding why your body feels unstable and giving you the tools to stabilize it for good. In this book, you'll learn what's really happening inside your spine, why poor posture and ligament damage are at the core of your health issues, and how to finally break free from the revolving door of ineffective treatments. Finding Calm combines decades of clinical experience for myself with step-by-step strategies for building stability, reducing pain, and living without fear of the next flare-up. So if you're ready to stop guessing and start living, this book is your roadmap. Click on the link in the description and download your free copy of Finding Calm now. Your journey to healing starts here. You can't expect to heal if you're not seeing the right professionals regularly. One visit is not going to cut it. Consistency is key, and that's why I always recommend that people commit to regular checkups with a chiropractor or a physical therapist who specializes in spinal injuries. This will ensure that your ligaments are healing correctly, that you're not developing any compensations or bad habits, and that you get the professional advice that you need for the next steps in your recovery. A targeted plan will help you make faster progress. So don't just hope that things get better on their own. Work with a professional who understands the complexity of ligament instability. All right, step number 3, the mind-body connection. Now, this may sound a little woo-woo, but trust me, it's crucial to your recovery. The truth is, when you're dealing with ligament damage and chronic pain, the way you think about and manage your body plays a huge role in your healing process. If you're constantly afraid of re-injury or stressed out because of the pain, you're essentially keeping your body in a fight or flight mode. This is the opposite of what we need. In a fight or flight state, your body is flooded with stress hormones like cortisol, and this makes your muscles tense, your ligaments more vulnerable, and your recovery slower. So, how do we break this cycle? First of all, relaxation is key. When your mind is constantly anxious or stressed, your body responds. This tension only makes your pain feel worse. You're not just recovering physically, you're recovering mentally. That's why a huge part of your recovery should include techniques that help manage the stress and calm your mind. Here's what you can do. Mindful breathing. A simple yet incredibly effective technique is deep belly breathing. It's easy to do and helps lower your stress levels, reducing that fight or flight response. Here's how it works. So you sit comfortably with your feet flat on the floor. You place one hand on your belly and the other one on your chest. You take a deep breath in through your nose, making sure that your belly rises and falls, not just your chest. Exhale slowly through your mouth. Repeat this for 5 to 10 minutes every single day. This practice isn't just about feeling calm, it reactivates your body's healing system, like the parasympathetic nervous system, which helps your body to relax and to focus on healing. Try it in the morning and set the tone for the rest of your day, or before your bed, and do this to help with sleep. Another thing is mindful meditation. Now, let's talk about meditation. This doesn't have to be some long, intensive session. Just 5 to 10 minutes a day can make a world of difference in how your body handles the stress. First, find a quiet space. Sit comfortably, close your eyes, focus on your breath, allowing your mind to clear. Whenever thoughts of pain or fear arise, just gently bring your focus back to your breathing. And over time, meditation trains your mind to accept the present moment instead of focusing on what you can't control, like potential re-injury. The more you prepare and practice this, the more control you gain over your emotional response to pain. And here's something else, positive visualization. Picture yourself living without pain, moving freely, and feeling healthy. The mind has a powerful impact on the body. What you believe in your mind can help manifest healing in your body. All right, let's dive into step 4, diet and nutrition. What you put in your body has a direct impact on your pain levels, healing, and overall recovery. When it comes to spinal ligament damage, it's not just about eating enough calories or hitting the gym. It's about fueling your body with the right nutrients to support the healing process and reduce the inflammation. If you've been living with chronic pain, you probably know how frustrating it is to feel like you're doing everything right, but still dealing with the pain. Well, one of the things that you can control every single day is what you eat. The right foods can make a huge difference in how your ligaments heal, how much pain you experience, and of course, how your overall spine health improves. So let's break it down. Anti-inflammatory foods. Chronic pain is often linked to inflammation. Eating foods that fight inflammation will of course help reduce the pain and speed up the healing. Think of foods that are packed with omega-3 fatty acids like salmon, mackerel, chia seeds, and walnuts. These are the foods that actually calm the inflammation in your body, making it easier for your ligaments to heal. Collagen-rich foods. Your ligaments are made of collagen. So eating collagen-rich foods can actually help restore and repair those damaged fibers. You can get collagen from bone broth, chicken skin, or even collagen supplements. Collagen supports joints and ligament health by improving strength and elasticity of the tissue that's around your spine. Now, another thing that you can eat is leafy green vegetables. These are packed with antioxidants that fight the free radicals in your body, which are harmful to tissues. Vegetables like kale, spinach, and broccoli contain vitamin K and other compounds to support bone health and reduce the inflammation. Now, another thing that's critical is hydration. Your tissues need water to stay flexible and heal properly. So drink plenty of water throughout the day. It might sound basic, but staying hydrated is crucial for keeping your spinal ligaments from becoming stiff and inflamed. By adding hydration foods like cucumbers, melons, and citrus fruits into your diet as well, helps to add that water. What you don't eat is just as important as what you do. Highly processed foods, sugary snacks, and trans fats can increase inflammation in your body, making pain worse and slowing the recovery. So cutting back on foods like sugary drinks, processed meats, and refined carbs will allow your body to focus more on healing and less on fighting the inflammation. By nourishing your body with the right foods, you're equipping it to heal properly, and you'll feel the benefits in both the short term and the long term. Finally, step 5. The long-term maintenance habits. This one is vital for making sure you don't end up right back where you started. And if you've been dealing with ligament damage or instability for a while, it's easy to fall into the trap of thinking that once you feel better, you're done. But here's the thing. Recovery isn't a one-time event. It's a process. And once you've started healing, you have to maintain that progress if you want lasting results. Maintenance habits are not just about what you do when you're in pain, it's about making healthy choices every day that keep your spine in the best shape possible. Recovery doesn't end when the pain stops. It's about keeping your spine strong and stable for the long haul. So, here's how to build these habits. Stay consistent with your stability exercises. Even after you start feeling better, don't stop. Continue doing exercises like the ones from the PostureFoundation program, which help to maintain that spinal alignment and stability. Strengthening your cervical spine and the surrounding muscles is an ongoing process. The more consistent you are, the less likely that you will experience the re-injury. Stretching and mobility work is another one. Make stretching a part of your daily routine, whether it's yoga, gentle stretching, or a full mobility routine. These exercises help keep your muscles and ligaments loose and flexible, reducing the risk and the chances of stiffness and pain. Ergonomics at home and at work. How you sit, stand, and sleep all affect your spine. Posture is critical for people with ligament instability. Ensure that your workstation is ergonomic and use a supportive pillow when you sleep. Having good posture throughout the day helps to prevent you from putting extra strain on your ligaments, and it helps to reduce the risk of pain or the injury. Checkups with your healthcare provider. As part of your long-term maintenance, continue to see a chiropractor or a physical therapist regularly. They can check your spinal alignment and make sure that you're staying on track. Regular checkups are an essential part of maintaining the spinal health. Mindful movement. Don't rush back into intense physical activity without being prepared. Be mindful about how you move and how much pressure you're placing on your ligaments. Whether it's lifting groceries or going for a walk, make sure that you're doing it in a way that protects your spine. By making these long-term habits part of your daily life, you are going to create a sustainable recovery plan that doesn't just stop when you feel better, but keeps your spine healthy and strong for years to come. So there you have it, the 5 things that you need to do in 2025 to manage your spinal ligament damage and start living pain-free. Prioritize stability training with exercises from the Posture Foundation, from the Posture Academy. Commit to regular professional care. Focus on the mind-body connection to manage stress and fear. Fuel your body with the right nutrition. Build long-term maintenance habits that support spinal health. Don't wait for tomorrow. Start today. These 5 steps will guide you toward a healthier, stronger, pain-free spine. And remember, the Posture Foundation program is free and it's ready for you to get started with these exercises right now. So just check out the link in the video description below and join. Let's make 2025 the year of your healing.